When I was in college and I was looking into different careers to pursue, my aunt was a pediatrician, so I went to hang out with her. And then my cousin came over and he was a dentist. And he asked me to come over to his office and just kind of see what he was up to. And there I really enjoyed seeing dentistry and working on patients' smiles. I just found it very rewarding. And after I got into dental school, he arranged for me to rotate with different specialties. One of them was an oral maxillofacial surgeon. And I got to hang out with him and see all the great things he got to do in the office. And that's what really led me to pursue the career. My specialty is mainly in oral maxillofacial surgery, all aspects, but I have developed a practice in head and neck cancer and reconstruction. The great thing about working with residents and running the residency program, I feel that like the residents keep me youthful. It's always fun and laughter with them, working in the operating room and the clinic. They also keep you on your toes, and so I have to be up to date on all the information so that I am best able to treat my patients, but also to answer their questions. My advice to young people pursuing an OMS career just would be to keep an open mind when you're going into residency. Sometimes we already think our practice may look like this when we get out, or we may only want to do a certain procedure. But after going through your training, things change, especially if you have an open mind, and it can be very rewarding, whichever way you decide to go. Unlike other insurance companies, his committee members are made up of oral maxillofacial surgeons who are specifically looking at each individual case and each individual claim from the perspective of an oral maxillofacial surgeon. Whereas other insurance companies, committee members are made up of other physicians not in the specialty and may not necessarily have the best insight into being an oral maxillofacial surgeon in the specific case. Serving on the OMSNIC Claims Committee this past year, I realized how much attention the OMSNIC Committee pays to each individual case and claim, really looking into the details of the patient's record, notes, the expert opinions and imaging, and really trying to give the best effort to defend each individual surgeon and each individual member, and really trying to defend the specialty.